Thank you very much. Please be seated. On behalf of the management team of the University of Medical Sciences, UNIMED Ondo, I want to warmly welcome you all to the closing ceremony for this all-important simulation course in clinical medicine that started about 3 months ago, specifically June 12, 2023, and it's ending today. We have here the principal officers of the university, starting with the Vice Chancellor, who is Professor of Public Health and Community Medicine and a Fellow of the West African College of Physicians in Community Health and a Fellow of the Nigerian Academy of Science. Distinguished ladies and gentlemen, join me in welcoming Professor Adesegun Olayiwola Fatosi, FAS. We also want to warmly welcome on this occasion the Deputy Vice Chancellor Academic of the University, Professor Rose Angela Nwoba. Mr. Vice Chancellor, sir, permit me to also warmly welcome and recognize on this occasion the guests and the facilitator, the leading facilitator for this event, this program. He is a professor of pediatric critical care from Tulane University, United States of America, Professor Olugbenga Akingbola. You're highly welcome, sir. And permit me also to welcome on this occasion the Director of the Center for Health Professions and Biomedical Education of the University, Professor Kayode Oshungbade. Welcome, sir. We also have here today the Director of the Institute of Advanced Clinical Studies of the University, in person of Professor Leroy Edozie. With the approval of the Vice Chancellor, you are invited to the high table, sir. So let's put our hands together for Professor Edozie. Thank you, sir. Okay, and with the approval of the Vice Chancellor, the Deputy Director of the Center for Health Professions and Biomedical Education is hereby invited to the high table in person of Dr. Akpalaba. You are invited to the high table, man. Let me also recognize and welcome on this occasion the Deputy Director for the Institute of Advanced Clinical Studies of the University, Dr. Oluseyi Adejumo. You're welcome, sir. Let me also welcome Dr. Francis Akinkumi. A round of applause for him. Thank you, sir. And senior technologist at the Center for Health Professions and Biomedical Education, Dr. Olayinka Ojo. And we have in the house too the principal auditor of the university, Mr. Obamuyi. Welcome, sir. Let me also recognize the Chief Security Officer of the university, who is in our midst. A round of applause for him. Thank you, sir. That will be the size of the recognition for now. We will continue to recognize other dignitaries as soon as we have them join us for this program. The next item here is the purpose of this meeting or of this gathering today, and there is no other person to do that if not the director of the Center for Health Professions and Biomedical Education of the university. Please once again join me in welcoming Professor Kayode Oshungbade.
The Vice Chancellor, Professor Adeshegun Fatusi, the Deputy Vice Chancellor Academic, and lead resource person, Professor Olugbenga Kingbola, my co-director in UNIMED, Dr. Oliroy Edozian. Distinguished ladies and gentlemen, please permit me to stand on other existing protocols already established by the university PRO. Well, I'm here to just briefly, tell us the purpose of this meeting. But I must say that the story of this meeting actually started about 2 years ago, or a little less, or a little bit less than that, when Professor Akingbola was here as a visitor to the teaching hospital, and during that time he met with our VC, and that was when the discussion about the passion and the will to have a clinical simulation laboratory established on the other side of the university. That discussion led to the appointment of Professor Akingbola as the special advisor to the Office of the Vice Chancellor on clinical skill simulation. And it was in that process that a call, I think for 2022 call by Carnegie Foundation was seen by Professor Akingbola, and we just, brought into it that, this is an opportunity for the UNIMED and and him as a fellow to apply for this fellowship. So we put together the application together, and by His grace, the application was successful. So Professor Akingbola arrived Ondo City for this purpose around June 11, 2023, and this training started on June 13, June 12 being a public holiday. So during the course of his stay, he took us through foundation course for some of the faculty staff, during which we learned. I also participated in that course, during which we were taught on how to prepare and set up a clinical simulation training or teaching. During the course also, though informally, we learned about the operationalization of a clinical simulation center, including its maintenance of the sim lab, how to schedule activities, how to maintain the facilities, the infrastructure, and all that. Senior medical students of the university were also taken through 2-week course on clinical simulation. And not only that, we also have sessions on basic life support trainings, CPR training for both teaching and non-teaching staff of the university. The last bit of it that we couldn't accomplish was to invite people from outside, medical, nursing, and health workers who practice in private practice to come. Unfortunately, we couldn't have that done. Well, we organized it, but we didn't have people to show interest. But again, we are not resting on our hands on that. It's a task that we will accomplish, because it will serve to actually raise awareness, sensitize members of the outside community of the existence of the simulation lab on the UNIMED campus. So having done all that in the last 3 months, so it is imperative for us to look back and, and of course assess what has been done or achieved so far. So we are here for the impact assessment of the trainings and activities which have occurred on this campus in the last 3 months. So some people will say we want to look at the good, the bad, and the ugly. But the important thing is for us to harvest all this to project into the future, so that we can continue to sustain the functionality of the clinical simulation center. So very soon we are going to hear from Professor Kingbola on the activities that he has been able to accomplish, as well as the assessments, the result of assessments that has been able to do. Then beyond that, we also listen to students who have passed through the center. We also listen to staff who has also passed through the center, so that we can harness or harvest all these comments, identify the gaps, weaknesses, and deficiencies, and pull together as thoughts for the future of the center. Mr. Vice Chancellor, ladies and gentlemen, this is the reason why we are here. And, I want to say that we should keep our minds open to pass comments freely, so that, all these comments will be taken in good faith for us to move this Clinical Simulation Center forward. Thank you very much.
Thank you very much, Professor Kayode Osungbade. Next on the agenda is the presentation of data about this program. And to do that is the lead facilitator or trainer for the event, Professor Olugbenga Akingbola. A round of applause for him.
Thank you. The Vice Chancellor, Professor Patusi, the Deputy Vice Chancellor, other stakeholders, senior members of staff in the university, ladies and gentlemen, I'm going to just quickly go through the what we were able to do. Since Professor Osungbade had already started out, I will go quickly to the assessment of the impact of the program. And by doing that, the first thing I want to do is the program overview. And this is just a summary of what we did from June 12 to today, which is September 6. The first, between June 13 and June 13 to June 22, we had programs on the foundational principles of simulation in healthcare, and the target audience in that course was the UNIMED faculty. The program objectives was how to develop needs assessment, development of clinical simulation programs, including feedback and debriefing. And the expectation was that at the end of the program, participants should be able to demonstrate how to design and implement clinical simulation for trainees, and also demonstrate their understanding of formative feedback and debriefing. And then the other aspect of the program was the curricular integration, which was from June 22nd to August 24th. The target audience was final year students of the university, final year medical students. The content topics were mostly organ system based, cardiovascular physiology, respiratory, CNS, electrolytes, introduction to basic life supports, and pediatric advanced life support. The learning outcome for the participants, which were the final year medical students, includes ability to demonstrate and interpret relevant clinical data and utilize basic science concepts for clinical decision making and critical thinking. They were also expected to recognize, assess, and stabilize critically ill children, and they also are expected to demonstrate basic quality CPR skills. Then the program moved on to CPR training, which targeted mostly, that was between August 30th and September 1st. And the target audience was the non-clinical faculty, including the security staffs. The main objective of this aspect of the program was to provide an introduction to first aid and basic life support. And the participants were expected to demonstrate at the end of the training program quality CPR skills. And then finally, we also attempted community outreach. I must say that on the 19th of July, in collaboration with Professor Jolade, who is also part of the Carnegie Diaspora Program, we were able to bring in secondary school nurses and teachers to the clinical center, where we introduced them to provision of CPR's basic life support skills, and they were expected at the end of the training program to demonstrate quality CPR skills. So between June 13th till September 4, this is just a summary of the activities at the center. I need to spend some time to explain the concept of curriculum integration, which is the second part of the program. Number one, anytime we talk of curriculum integration in the setting of simulation, it's simply an integration of subject content in the medical curriculum with subject competencies or skills in that curriculum. So, in the medical school and the nursing school, the curriculum, the clinical curriculum content needs to have a complementary competency and skills which are better acquired in a simulation center. That's the whole concept. It just happens that I use the program for the medical student pediatrics as an example of how to incorporate curriculum integration into the medical training. This could also be done by our colleagues in internal medicine, in surgery, nursing, and other aspects of clinical medicine. And the whole idea is, number one, to select achievable learning outcomes in each area, consider what clinical and simulated cases that will most likely enable students to achieve the desired outcomes, and then of course the different clinical services in medicine, surgery, pediatrics, community medicine, and nursing will now plan a simulation-based activity to reflect these outcomes. Now, I must also say that while curriculum integration will enable acquisition of prerequisite clinical skills before the trainees, happens to be medical students in this case, before actual patient contact, it could also serve as a refresher or reinforcement of skills required for mastery of low-frequency, high-risk events for residents, nurses, and experienced providers. I need to spend some time on that because this program should not be targeting medical students alone. As long as we have resident doctors who are in training and we have junior faculty who have just completed their training, they need to engage in skill building and reinforcement of skills. There is what we term in my own area, low frequency, high risk events. These are events that doesn't happen every day. But once it happens, if you don't have the prerequisite skills to intervene, the result and the consequences can be disastrous. Now that we have a simulation center, it gives us the opportunity to have people take refresher courses in specific areas. In anesthesia, for example, their resident can learn about intubation, difficult airways, chest tube insertion for surgery residents, resuscitations, etc. These are things that we could also do under the curriculum integration. I will now move on to assessment data presentation. Now, in the 3 months that we were planning and executing this simulation program, we needed to find out how impactful the program was. So, what we did is to use this so-called Kirkpatrick's model of effectiveness of any training. It just happens that this is a simulation training. Now, the model, there are 4 levels of assessment. Level 1, characteristically known as reaction, is how did the participants feel about the training program. Level 2, described typically as KSA, knowledge, skills, and attitude, is to what extent did participants improve their knowledge and skills and change attitudes as a result of the training. Level 3 is behavior. When you undergo any training, it's supposed to change the way you practice, the way you do things. And the questions you will ask at a level 3 assessment is to what extent did participants change their behavior. In this case, it will be practice behavior in the workplace, in the clinical arena. And then level 4 assessment is where this will interest the Vice Chancellor. The question is there a return on investment? Everything that we've done here, what are the evidence that the organization, which this case will be UNIMED, would benefit from this investment? It is obvious that we cannot do a level 3 and level 4 assessment now. We need time. It's something that will come with time, and it does require some kind of data that is not available in these 3 months. The other problem with particularly level 3 is that for you to be able to assess whether the training has changed behavior, you have to look at the system where the trainees are placed to function. Do they have the prerequisite equipment? Do they have the support system? So, I'm not going to spend any time on level 3 and 4 because that's beyond our reach. So we will spend time on level 1 and 2 assessment. For level 1, the question we are asking the participant is simple. How do you feel about this program? So the instrument to do this is survey the participants about several aspects of the program. And of course, level 2 is data analysis of pre and post tests. And that's what we have for our assessment. So, reaction. How did participants feel about the training program? We sent out a survey. This is an anonymous survey, by the way, and it was done with Google Form in these specific areas of the program objective, the course material, the relevance of the content, and of course, the facilitator knowledge. So, with respect to the objectives, was it defined and achieved? There were 60 responses. 96.7% of respondents were in agreement that objectives of the course was clearly defined and achieved. With respect to whether or not the course meets their expectations, there were 60 responses. You can see from the pie chart the distribution with the respondent varying from completely and also very much that the course met their expectations. Then we want to ask them to rate the overall quality of the course on a scale of 1 to 5, 1 being poor and 5 being excellent. You can see from the pie chart that 78% says the course was excellent and 21.7% says that it was very good. So we move on to the relevance of the practical aspect. Were the practical demonstrations relevant and aligned with real-world healthcare challenges? I must say that when you are teaching this course, as it is in any instance, you need to look at the practice environment and the circumstance of your target audience. So when we put that questions to them, 95% said that the practical demonstrations was relevant and aligned very well with their real-world healthcare challenges. Instructor knowledge, they were approval of instructor's knowledge. I won't go too much about that. So we went into teaching effectiveness survey. Simulation method as a teaching tool is different from clinical teaching. And that is the problem we clinicians have. Before I went into simulation, I did not know that there's a world of difference in how to instruct adult learners that you are trying to teach. So, this was an opportunity for us to ask that question. How effective was the teaching method? 73.3% said it was excellent and 21.7% very good. How engaging and interactive was this course? The result is also obvious. 56.7% agreeing that it was extremely engaging and 43.3% that it was very much engaging. Now, to the questions whether or not the course adequately prepare the participants to apply what they learned in simulation techniques in healthcare settings. Over 93.3% said yes, it adequately prepared them. So you can see that we have an idea of what we'll be able to achieve with this training program with respect to the practicality of it. How well does this prepare them for the clinical arena? So we have comments from the students. I didn't know Dr. Ojo would have a better one than I did, but this was what aspects needs improvement. They complain about time and the length of lectures. They want more time for hands-on, and they also equally recognize that the time allocated was too short. So we all were in agreement with that. that, time was a limiting factor here. What aspect of the course is most valuable? They all talked about the practical aspects. You can read the comments. I'm not going to waste time on that. The hands-on practical exercises, they wanted more of that. They liked the idea that most of the cases was simulation case studies and then hands-on practical experience. I must emphasize that if in future, when students are brought to the simulation center, there is enough evidence in the medical literature that case-based teaching is very effective. What does it do? It encourages critical thinking, it encourages active learning, and it encourages transformational learning as well. People can relate to that better. So we did that for the most part. Now, this is where the rubber meets the road. This is level 2 assessment now. We've looked at the reaction, the overall reaction of students. Do you like the course? What do you like about the course? But now, in these 3 months, were we able to transfer knowledge, cognitive knowledge, to the participants? How much of skills were we able to transfer? I put a question mark there because of time constraint, we did not collect data soon enough about specific skills, particularly the CPR skills. So I think halfway through the course, Dr. Ojo brilliantly started collecting some data which we can still analyze, but we have sufficient data to assess cognitive knowledge. You realize that the mannequins, when they are doing chest compressions, they have an app that tells them, and at the end of the exercise, it grades them whether your chest compression was 70, 80% ventilation. We should be able to look at that over a period of time and compare when they first started the program. So I don't have data on skills, but I do have data on cognitive knowledge. This is just a clustered column chart, just looking visually, looking at comparing the pre-test and the post-test. You can see that post-test, they took a test at the beginning before the lecture started, and at the end of their second week, they took the same test. And visually, without any numbers to this, you can see significant improvement in the post-test scores. But then we went a little bit further and plotted interquartile range, median values of pre-test, post-test, and knowledge gain. The knowledge gain is the difference between post-test scores and pre-test scores. I'm going to spend some time explaining that. You can see that the median score for the pre-test was 46% compared to 85% median score for post-test. And then the score range was 39.5% to 54% for pre-test. But for post-test, the score range narrowed significantly from 77 to 82%. The lowest score was 19% for pre-test and 77% for post-test. The highest score in pre-test was 73%, and the highest score post-test was 100%. What does this mean? When it comes to knowledge gain, again, knowledge gain was obtained by subtracting pre-test scores from post-test scores. You have a median of 38%, and the lowest gain was 27%. Highest was 46%. I will explain this in a second. And the range of knowledge gain was 14 to 69%. So, interpretation of result. There is a median improvement of 38% in knowledge gain from pre-test to post-test, which indicates substantial overall learning progress. I must say that kudos to the students that some of these materials, at least a good 25% of it, particularly when it comes to resuscitation and all the stuff, was a little bit new material. And yet, we were able to demonstrate evidence of substantial gain in knowledge. The teaching method, which is simulation, appears to have had a positive impact on students' understanding of the subject matter. Some students shows exceptional progress as high as 46% gain in knowledge. Remember, the knowledge gain is your post-test score minus your pre-test score, while others showed more modest improvement. However, it is important to note that even the lowest gain of 27% demonstrate progress, though there's room for further improvement. If we had more time, you can see an actual increase in this quartile. The post-test scores demonstrate a higher level of knowledge across the board compared to the pre-test. And then the last thing here is worthy of note, the spread. The spread of scores has decreased in the post-test, suggesting a significant reduction in knowledge gap among students. So let me just, that last statement, let me just illustrate that here. This is the box diagram for knowledge gain. You can see the spread was between 14 to 69%. But then look at a median of 38.5 and a upper limit here of 46%. When you compare that with the post-test scores, you can see that that range has narrowed significantly. And that means that the knowledge gap among the pool of students who were in this course has decreased with exposure. So I think I'm going to stop here and have Professor Oshungbare to take the comments from other stakeholders, and then I'll come back and give the rest of my talk. So we are now on stakeholder feedback. What we want to do here is an open discussion. Faculty and other stakeholders who were part of the course can share their thoughts and experiences regarding the program, and that will include what worked well and what can be improved. It will be necessary for us to hear negative comments, because that's the only way we can improve ourselves. And either now or subsequently, a SWOT analysis is important, which is strength, weakness, opportunities, and threats. I will address the opportunities that I have been able to identify. So, Professor Oshungbare, this is stakeholder feedback.
Well, thank you very much for the presentation. As I said, the floor is open for us to share our thoughts and comments based on experiences that we had when we went through one program or the other at the center. There are categories here, and for the sake of time, we want to recognize that we have students in the audience. We have senior teaching staff in the audience. We have senior non-teaching staff in the audience, and we also have junior non-teaching staff in the audience. So I think we can take maybe two comments from each of these categories so that we can manage the time appropriately. Can we start from the senior non-teaching staff? Volunteers? Can we have two people to tell us their thoughts? What worked well? What can be improved on? Your experiences? Yes, please. Can we give him a microphone?
Thank you, sir. I sincerely must thank the university for organizing a teaching like this. Actually, there are several things I personally observe and gain in the teaching for the period that I attended. One, it talks about how to address emergency situation in a place where we don't have doctors or medical personnel. And anybody here should be able to address such situation, at least to bridge the gap between when the doctors or those who are knowledgeable in the medical field will be around. But he made a very cogent point that is very relevant to our system here, which is the university. Having known the existing problem in Nigeria, in the medical world, but he addressed the one that is related to the university here. That one, which you have a general emergency number that anybody should be able to access in case there is a problem or a student or anybody collapse in our environment, in the classroom, in the lecture room, in the student hall or hostel. So he pointed that one out, and I see that it's very important as well that we address it, that we should have an emergency number that anybody should be able to call or somebody should pick, and like a quick response number. And aside that, it talks about the first aid equipment, what we should have in. It talks about the nose cover and I don't know the medical name used for that particular thing that covers the nose and the mouth together to assist in clearing the air waves of such a patient. So I think those things are very, very germane. They are very, very necessary in order to save life in the presence of an emergency. And that's what I want to say for now, sir.
Bukola, can you please document these comments for us, please? Can we have second comment from the senior non-teaching? Senior non-teaching, okay. Senior, junior non-teaching staff. Can you have two people telling us about the experiences, either positive or negative, as been told? Please, let's talk. Our security officers. Yes. You know. Well, this audience, you know, CSO, Chief Security Officer, I see that gesticulated. Yes.
Thank you, sir. I will not be able to pass any comment for now, sir, because that period throughout we were engaged in this examination in Odoshida. I was not able to partake in it throughout. It's only today I come down here.
Thank you, sir. Well, can we go to the students? Our students, so let's hear your voice. Yes, there's a hand up. Yes.
Good afternoon, sir.
Okay, yes.
My name is Peace Adewoyin, and I'm a medical student. And I want to say that the training we had was a very, very important one, because we've been having a lot of classes about what has been taught, but the hands-on were not really there. And so personally, it's brought whatever we have been taught into like the reality. So it was really helpful, and I would advise that every other student, even not just final year student, but probably from like 400 level students are exposed to it. And also there was something I learned particularly about the direct technique that was taught us, and it has to do with being able to detect what is wrong with the patient on the first sight, and then the interventions that you make to help the patient out, the reassessing of the patient, and then evaluating the patient. Then communication, and that part was actually very much emphasized, because passing of information might be altered at any point, whether you passing it or the person accepting the information. So you have to pay special attention to ensuring that the information you're passing is taken up the right way, and then teamwork, working together with every stakeholder in the medical team should be done very well. So it was very, very delightful period of time for me. Thank you, sir.
Can we have other comments from students? While those comments are being taken orally, we also have some collated comments from students which are being relayed. So as we listen to comments, let us also read these comments on the screen. Thank you.
Good morning. I'm John Aleriwa. So I was privileged to be part of students who engaged in the simulation course. So I have comments, then I have suggestions too. So first, I want to say the simulation program coincided with some of our programs in school. For example, now it came during the time where we were having community medicine and medical legal posting. So we have to divide our attention between two programs. So we were unable to give so much of our time to either of the two programs, because while we're doing simulation, after that we have to go and do medical legal. So that's one comment I have to pass. Then number two, I want to say the teaching methodology that was employed during the simulation course was superb. It was really interesting, because it's different from the way we've been taught so far, right from the time we've started this school, from 100 level up to 600 level. The instructor was particular about the student understanding what he wants to pass across. And I think that should be what most instructors should emulate. Because it's not just trying to give us the information, you want to ensure that, okay, the information he has given to us, can we really use the information in making critical decisions? So that's one thing I want to say about the simulation course. It widens the way we think, the way we approach things, our understanding of situation situational awareness. We are made to understand that, okay, we have to have situational awareness when it comes to certain things. And that's what the instructor has been able to expose us to. And that though all stages of learning, there are stages of ignorance and there are stages of mastery. That even though we should recognize that, even though we are in a stage of ignorance, we should be consciously aware of the fact that we are ignorant, because that's the only way we can improve. So he enlightened us on that conscious ignorance is not a bad thing, because we know that yes, we are conscious of it. So then there's room for improvement. So overall, I want to say the simulation program was a good one. It has helped us in our clinical skills. It has broadened our understanding of how to address situations in critical management of patients. And lastly, I want to suggest that it should be done in a way that it won't coincide with other activities that the students will engage in. Thank you.
Well, thank you very much. Your observations are noted. Is there another student who also wants to speak? Thank you.
Good afternoon, the panel staff and students. I want to say thank you to the school, the university, and also to Professor Akingbola for this simulation course that we had. Of course, we understand that we know that we are aware of simulation methods, but this course, it helped us to understand that there is a gap, and I just realized the extent to which there is a gap between theoretical aspects and the practical aspects. And there were a lot of materials accessible to us, mannequins and simulations in pediatrics. It was mainly a pediatric course. And we were able to know where we had limitations, and then the things that we learned in class in word rounds and so on, we were able to practicalize them on the mannequins. But because we are students, we know that we are not the frontliners. We don't always have access to patients, caring for patients the way they're supposed to be cared for, like the doctors and so on. And also in our environment, we do not have access to some of these machines normally. Like before now, I'm not sure any of us had seen a monitor the way the simulation monitor was. We have never seen. The monitors we have usually just have blood pressure, pulse, and so on like that. So we know what we need and we know what is supposed to be done. But the limitation that we had is the course was quite short, it was 2 weeks. And I would suggest that in future the course should be somehow integrated into the school calendar, into the curriculum, so it can be longer. And then it was pediatrics. Yes, pediatrics is important, but there are other aspects of medicine that also we could benefit from in simulations, like obstetrics and gynecology and even surgery. And I know that we have some of the materials in the library, so I would suggest that this can be done more and we can use those materials more, even to understand the course better. And this course has helped us to have more confidence in treating patients the way they need to be treated, and then we now know how far we have to go out there and learn and take extra courses in order to better our medical career. Thank you, sirs and Ma. Thank you.
Well, thank you very much. Your observations are noted. I think let's move to our colleagues, clinical teaching staff. Dr. Adejumo, Dr. Akinkomi, and can we have two of us? Or is there any other clinical teaching staff in the audience? Yes, Dr. Akinkomi, thank you.
Thank you, sir, for this opportunity to make some comments. I want to thank Professor Akingbola for this opportunity again. A quick response to the students, like Professor Akingbola said, because it's a pediatrician, he uses pediatric examples. It cut across all fields. So the course is not for pediatrics, it's across all fields. And it's actually shown in the response of the faculty people that attended. We were very few. Though Professor Akingbola said it's okay with the few, the response was not really encouraging. I think myself, Dr. Adejuma, Dr. Asia, and one or two other people attended. Maybe next time we need to, Professor Akingbola was even saying maybe we will tell the VC to attach some things to it so that people will take it serious and attend such training so that they can formulate their own curriculum of training in their different fields. So to address the issue of it's not pediatrics alone. Then the issue of forming a team. Prof. Akingbola was saying during the training that we might need to form a blue code team in the hospital in the different campuses that can be called upon at any point in time if there are cases of resuscitation. The teaching and training has opened my eyes for us to do that because people collapse here and there. If there is no organized way of people that will do it, we might have equipment scattered all around and you call people, we don't know how to get it. So we need to form a team in the hospital and in the various campuses to do things. In all, the course is very good for people in the university and for people in the community. I'm happy to hear that they were able to go out to invite the nurses and secondary school teachers. Myself and Dr. Adejuma still plan to do something like that. Get secondary school teachers to come and learn basic life support. I think at the beginning we saw the issue that happened in Lagos when a child died at the inter-house sports. If people have been able to do some basic resuscitation at that spot, maybe we would have saved the child. So if we can replicate the same thing in our environment, it will help. The course is excellent. Thank you, sir.
Thank you, sir. Can we hear from our Vice Dean, Faculty of Clinical Sciences?
Thank you, sir. I want to appreciate the university management and our resource person, Professor Akingbola, for an impactful program. Well, I was opportune to be part of the training, and I think overall, even as a clinician, I was able to learn. It was able to improve my own clinical skills. That's one. Then two, I also learned how to improve my teaching skills, actually communicating clinical skills to students. Overall, it was very impactful. My suggestion is that as a university and as a faculty, we should find a way of incorporating it into our programs. Not particularly that there will be a special posting for simulation, but when students are rotating through medicine, as part of teaching them medicine, we incorporate simulation technique, simulation training into each of those postings. So maybe as we are teaching them, before they start examining patients, it will be part of the program they will go through. So they will undergo simulation as they pass through all the clinical posting, pediatrics, O&G, internal medicine, surgery. And I also want to suggest to the university management to consider putting an incentive for those people that have attended one way or the other. How can we encourage them to attend more? Then for those people that did not attend, how can we improve attendance? Just like it's been said, if possibly there's a way we can incorporate it, but annual review, programs that you've attended, certification, all those things would improve attendance, and people will also see the reason to attend the program. And also too, there's also a need for continuous feedback. So as we're trying to do this on our own, there should be a line of communication to our resource persons that in case we have some difficulty, we can express our difficulty to him and he can put us through, even while not being with us. Thank you very much.
Well, we want to thank you most sincerely for all your comments. Didi, are you raising up your hand? Okay, so please. So,
thank you, sir. All protocols duly observed. Please, I also want to join my colleagues, Dr. Akinkubi and Dr. Dejumo, to thank our resource person, Professor Akimbola, and the management, the UNIMED management, for this program. With all due apology, my CMD, sir, I tried to carry you along, but you were on leave. I'm very sorry for that. In the next program, so to say, we wish to, with your permission, sir, our Vice Chancellor, extend the program for the security officers to also the security in the University Teaching Hospital. It was an oversight. We only invited those around the university. Then, why I say that is the essence of the aim of the course is not just restricted to the university and hospital environment. Out there, when they go out, with the knowledge they get from the course, they will be able to be very useful and assistive in anywhere they go and there is an emergency. In the absence of any doctor that would be able to do a CPR, they should be able to give some first aid before the victim is taken to any nearby hospital. That's that. Then secondly, to the student that was asking or saying she would wish the course to be incorporated into the curriculum. Yes, I spoke with Professor Akimbola, and he has given us some tips on how we can include it in our program. He has already given us, or rather me, some tips, skills, how to incorporate ENT aspect of it into the students' curriculum. And I'll bring it to the management so that we can see what to do about that. Thank you very much, sir.
So at this point, let me hand over the mic back to Professor Akimbola. I think the program, I think number 7 summary. Professor Akimbola, having listened to all these comments, taken in due, well, the comments have been taken and they've been harvested and they'll be used appropriately at the appropriate time. Professor Akimbola.
So before I go too far, Dr. Ojo, do you have any data to present? Yeah, I think you should do that before I go to this last segment of mine.
The Vice Chancellor, Deputy Vice Chancellor, all other protocols duly observed.
Just before we continue with that, at this point, I want to make some adjustments. just want to intimate this audience with the presence of the CMD of the Unimed Teaching Hospital in person of Dr. Oluwole Ige. A round of applause for him holding us on this occasion, sir. Thank you, sir.
Sorry, looks like we are the slides. Okay, so I'm just quickly going to go over this because of time constraint. Like I said, that we have opportunities here from what I've seen. And when the VC asked me to conduct the training for the security staff, by some chance, I stumbled on this video on Arise News. And I'd like for us to take a look at that. Oh? Yeah, that's it. Is there a volume to it? Okay. I'm just going to describe why I wanted us to see this. Interestingly, when it looks like you are the only one doing something, you'll be surprised who else is doing this elsewhere. In that interview, it was interesting that there is Health Emergency Initiative, HEI, going on in Nigeria currently. And the gentleman that was interviewed in that video actually said a lot of things that was very close to the vision that the Vice Chancellor expressed. Number one, they are into training policemen, first responders, and also they partnered with the Lagos State government and were teaching final years secondary students and have a first responder club. It's kind of similar to what we were doing here. So the point I was going to make from this video is that number one, we have opportunities for effective utilization of this center here. The first thing is It will enhance the educational mission of the university. That is what we've been saying all day. But the one thing that we can also do is a first responder training program that will make this university a destination center for training first responders in basic life support, pediatric advanced life support, and advanced trauma life support. For the audience, there was a meeting with Professor Jolade that explored this possibility. However, beyond that, we can also develop training programs that will lead to certification, not a degree course. Because this is a medical university, some of the people who attended this course could well have been emergency medical technicians. These are individuals who are trained not only in basic life supports and resuscitation, they can do things like setting IVs, starting fluids at the scene of an accident. This is something that we can do. We can also collaborate with local and international organizations. The HEI is the Health Emergency Initiative. Actually, when I saw that video, I tried to call them. American Heart Association is really very open to having something like this. One of the things that we can explore is to make this center an American Heart Association center for training for BLS, ATLS, and invariably develop certification courses for emergency medical technicians. Then finally, research and publication. Research and publication of unique experience with simulation in an African university. I must say this is probably, I don't have the data, but I won't be guessing wrong if this is one of the few universities in Africa that owns a simulation center. Whereas everywhere else in the world, if you have a medical school, you almost always must have a simulation center. The world will be out there craving for publication from this center. Even some of the things that we have done these 3 months, I will be collaborating with Dr. Ojo and his staff and see if we can get abstract from that. The one way that we can move this forward is for the center to have affiliations with other simulation centers outside of Nigeria. So, with everything said, I will conclude by saying we need an action plan. And this can be a collaboratory effort to identify all the things that we have talked about and to assign responsibilities to somebody who will be a simulation champion for implementation of everything that came up with this discussion. I want to take permission from the Vice Chancellor, sir, if you don't mind, that the individuals that I'm going to call their names should stand up, because I could not have done this without some foot soldiers. Dr. Ojo, Mrs. Akin Fesik, Ms. Akin Badewa Bukola, Mr. Akintuyi Festus, Mr. Adewuyi Oke, Ms. Aluko, Mr. Akinfolarin Michael, Mr. Olabanji, and Mr. Akinola. when people are given recognition, oftentimes a generic statement is made, oh, for a job well done. I don't typically do that. I want to say specifically what these individuals did to make my life easy when I get here. Dr. Ojo would communicate all the plans ahead of time and make sure that the center is available for my use and for the students. Even Mr. Kinfesi made sure I got water and refreshment no matter what time of the day it's. I truly appreciate that. Mr. Festus, when I carry my bag around, there are over 3 computers there with a lot of wires. He will set it up and make sure that everything is restored. And of course, Mr. Adewuyoke is my computer go-to person every time we are stuck. So for these individuals, I want to say a big thank you, because without these foot soldiers, I can get all the accolades, but I want it to be known that they were extremely helpful. And I want to also thank the Vice Chancellor for what I would describe as a transformational leadership skill. Because when we spoke about this, I think it was 2019, you just pointed out, you just showed me a building that was incomplete. And by the time the building was completed, you made yourself available. And I think we should appreciate that, and I want to thank you especially for that. I guess the reason why that is important is there is usually a cultural barrier when Nigerians overseas wants to come here to help. I was discussing with Professor Edozian earlier on. The cliche over there is that when you get here, they will frustrate you. They won't make themselves available to you. I was not frustrated by Unimed. You made yourself available. And I want to say thank you. Thank you very much.
Thank you very much, Professor Akingbola. We have gradually come to the end of this program, and next is the Vice Chancellor's closing remarks. Please put your hands together for Professor Adeshegun Fatusi.
Thank you. Good morning, everyone. I think it's getting to afternoon now. Good afternoon, everyone. And let me adopt the protocol that has been very well laid, even though I would still like to recognize one or two people. Let me start with my brother, friend, and colleague, Dr. Oluwalege. I'm sure that this was not in itinerary today. He had just come back a few days from his leave. It's good to have you, CMD, and thank you for your partnership. Of course, the DVC academic is here. I have a lead technical person who had come all the way and spent the last 3 months with us. The director of the centers. I'm talking about the Institute of Advanced Clinical Sciences, as well as the Center for Health Profession and Biomedical Education, and our colleagues and students. June 12 is a date that Nigeria hardly ever forgets. Every time you mention June 12, it rings a bell and it brings some memory. I think for us in Unimed, June 12 has come to be a significant date in a new way. I think that June 12 of 2023 marks a watershed in our development as an institution. And I want to thank you very much, sir, for making that happen. A couple of points you made, I'm not going to respond to them, but I think it's important to highlight a couple of things. I think that it's important to start by saying that Without your coming, sir, without your willingness to come, without your willingness to partner with us, this could not have happened. You did not only thought of the idea, you made yourself available. You even brought your wife along and brought us equipment. We are deeply, deeply grateful. We, as an institution, I always tell people that one of the things we want to do is to cover the gaps that exist in Nigerian health sector, and a lot of them exist. And the area of medical simulation is a big one. The idea of medical simulation is beginning to catch on in the country. But even when we set up simulation labs, they are not effectively used because of some of the gaps and realities that you have identified and brought it for. Let me give an example. When I was provost in Ife in 2013 to 2017, we set up a clinical cell lab. In fact, it's bigger than what we have in Unimed. Nobody used it. Nobody. We raised money all over the world from our alumni to set it up. And as I reflected over the last 3 months, I understand why that was the case. Number one, there was no integration into the curriculum. So people didn't see it as essential. They didn't see it as part of the teaching curriculum. And that is one thing you have strategically helped us to do, to begin to understand how we can integrate this into the curriculum. And I want to promise you, sir, that we will carry that to its fullest limit. We will make sure that this is integrated into the curriculum, and I'm going to be charging Dr. Papa and the team, and the Director of Academic Plan to do that. Luckily for us, we are at the stage where we are revising our curriculum, medical curriculum. And so there is no better time than now to make sure that this is part of the curriculum. The other thing that I think is extremely important is the issue of building capacity of trainers. Even if you have something in your curriculum, if there are no skills for curricular delivery, it's a bloody waste of time. And I think this whole idea about building capacity of trainers is something we, as a university, we are very passionate about. We have a program whereby every lecturer in our system must undergo training in teaching. I think this must be part of what those who are coming to the clinical faculty and the nursing faculty must also be training, so that it's part of the package of enhancing their capacity to deliver in that respect. The third dimension that I also think it the chord with us has to do with this idea of community responders. I was saying here a couple of, not 2 days ago, we had the leadership retreat. And I was reminding the leadership of this university that our motto is for learning and community service. And therefore, in every dimension of our operations, thinking about the community and how we can impact the community is critical to our mission as a university. And again, you have helped us to expand our vision in that respect. Going forward, what are the likely things we will be doing, or not the likely, what are the things we are committing ourselves to doing? Of course, I've highlighted a few. But let me say that one of the things we'll do is to ensure that we become a center that does all the training that you're talking about. When I was working in Guttmacher Institute in New York, the institute pays Red Cross to come and train people. There are only 2 of us who are physicians in the entire organization, among the entire research division. And yet people who are trained, that you are administrator, you are all trained. And so there's no reason why a University of Medical Sciences cannot do much, much better than the research institute that consists of practically demographers and sociologists. And so part of our commitment, like I told our team yesterday, is that every medical student, every nursing student, every student of whatever course that come to this university will be trained in how to respond to emergency. It is a norm that's going to happen from this new semester we are entering in. I often tell people about my experience. I often tell people about my experience as a graduate student in Israel. One of the interesting things is once there is an emergency, you see everybody knows exactly what to do. In fact, when you come back to a place where a bomb had happened in 1 hour, you won't believe that bomb happened. People are so put to action, they know what to do, and everything is cleaned up. And I think that that is one of the things we must begin to do as a university, create that kind of opportunity. You talk about the emergency medical technician, sir. Again, it's something I can assure you that I'll be willing to do, and you know you'll be available to support us to do that. I'm glad the same time I was just talking about it a few minutes ago while you are talking about it. There's the gap that we must close very, very quickly. Because obviously it's a huge gap and nobody is closing it. We brought in Dr. Wale Olaomi, who is leading West African College of Surgeons in trying to do training around traumatology. We brought him here just before accreditation to take a look around and see what we can do. And so we are going to work around that. Luckily, the West African Health Organization had developed a curriculum. I was part of that curriculum a couple of early part of this year, looking at the whole issue of emergency response. In fact, they had developed a BSc program. Well, I don't think a BSc program is what we need now. What we need is a certification program that can raise people as quickly as possible. So we work on that, and hopefully working on that, we should be able to make a difference as quickly as possible. The CMD told me that it's rounding up soon. I told him back, I said, I'm rounding up soon. It's not you two that are rounding up. Both of us are rounding up. I said, we don't have time. And therefore, we go to swing to action as soon as we can to make sure that this becomes a reality before our tenure expires. It's interesting, as I was looking at our program for our students, that our nursing students have BLS as part of their curriculum. They have a whole course. They have a whole course. And they are not using these facilities because they have their own laboratory. But there's a need to integrate all the facilities so that all students can have a maximum opportunity to use them. And that's why, God helping us, from October, November, all the laboratories of nursing will be located there because we are bringing the nursing students back here by October, November this year, God helping us. And those are part of the things I think will help us as we go forward. Let me answer by, number one, thanking the students and other participants, because even if we put this together, nothing will happen without your participation. So thank you so much for using the opportunity to learn and to grow yourself. What happened briefly in the last few minutes when Professor Kimbola was trying to show the video, actually is a good lesson about when you don't integrate emergency response into programs. No, they had the cable. They were running here last minute. If they had integrated this to their plan and they had rehearsed it, when this happened, they know exactly what to do. They will not be running. And that's the reality. I think that's a life lesson about why all of us must make the issue of building skill continually a part of our life. And so don't think and don't take it that, oh, we have had this. Take this as the beginning of a new experience in developing your capacity and developing your interest. Let me thank our staff. I think the staff dimension is much, much challenging. I can make sure students get here. If they don't want, all I do is make it a test. They'll be an exam in this room this morning. Or they'll be here. They have no option. But you can't do that for staff. So you have to find a good motivation. I mean, if a student doesn't come to class, very easy. Tell him, you're not doing the exam. And that's the end of it. And if you want to do the exam, you can. It's clinical exam, Abi. You must certify the examiner. Nobody else can tell you that you satisfy it or not. So, well, I'm sure you know I'm joking. But on a serious note, we have to find a way to get our clinical staff to be involved. And it's not because they lack interest. Let me acknowledge that. But I know that the whole work schedule of being a clinician, going to the clinic, teaching students and all that is crazy. But this is essential. And that's why we must strategically find a mechanism to make sure that we are able to do what we need to do. And I think that answer, and I'm going to charge back Professor Kadoshu Bade Akbalaba and the rest, that I think that the answer to moving forward is developing this action plan. So we know exactly what we are doing, when we are doing it, how we are doing it, who is doing it, with what we are doing it, and what resources are required to do it. I think that must be the starting plan, and I do hope that in 4 weeks' time we can receive an action plan from you. Management is committed and will be willing to put all the resources that's needed to make that go forward. Again, I cannot thank you enough, sir. Thank you very much for, but as you know, this is the beginning of our long life relationship. I know we started talking about the possibility of even putting another proposal to Carnegie. But I think more importantly, I'm sure that now you can fully take on the role as a special advisor to our institution in the area of simulation. So we do hope that we can continue to benefit from your experience. Again, I wish our students, I wish our staff, I wish I didn't have all these administrative encumbrances, and I will have been part of this training. But that said, I'm sure many of the training has been recorded, and I also will learn from it. Thank you so much, sir, and thank you, everyone.
Thank you, Mr. Vice Chancellor, sir. May I invite the Deputy Vice Chancellor of the Center, Dr. Akbalaba, to step forward and give vote of thanks. A round of applause for her.
Correction, PRO, sir. I'm not the Deputy Vice Chancellor, please. Thank you, sir. Thank you, sirs. Please, before the vote of thanks, Mr. Vice Chancellor, sir, permit us to do a little presentation to our guest lecturer, Professor Olubenga Akimbola. Thank you, sir. Our dear Vice Chancellor, sir, please, sir, we would want you to present this to our resource person, Professor Akimbola.
Professor Emeritus of Pediatrics at Critical Care to Lynn University, in appreciation of your immense contribution to the development of our simulation laboratory and the training of our staff and our students. We indeed appreciate you very deeply, and we look forward to continue this relationship. Congratulations. Everybody come and join. Maybe I think come and join. Before we run away.
Thank you, sir. We'll call on our CMD, Dr. Ige, to do the next presentation. Thank you, sir.
Let's just say it now. The university management, we want to once again appreciate and thank Professor Akingbola, who has helped in bringing to life this part of our gaps and inadequacies that we have been talking about. Have not been able to find a way to kickstart this the university emblem and envelope, and we hope that this will be the beginning of a new story in emergency interventions in terms of healthcare in Nigeria as a whole, not just for this community as a whole. I hope that this will transform into something much more that will be even beyond this generation. And thank you very much. You're welcome. Sir. Yeah.
Let's take the photograph with this one, and then we'll.
We call on our DVC ACAD, Professor Rose Angela, to do the next presentation. Thank you, ma'am.
So I've been asked to give you this, appreciating you on behalf of the center. The VC said it's for your wife, but I think you can use it. May use fabrics also, so you remember us when you use it. It's an adire. I'm sure you don't have it in the US. Thank you very much. We appreciate it, sir. Yeah.
Thank you. Thank you, everyone. So, quickly, without wasting much time, we thank our dear, amiable, energetic, erudite scholar, innovator, dreamer of dreams that come to pass, not the ones that are discarded. Initiator, name them, our dear Vice Chancellor, Professor Adeshegun Fatusi. Thank you so much, sir. We thank our DVC, ACAD, Professor Rose Angela Woba. Thank you so much for always being there for us. We are very grateful to you. We thank our CMD, Dr. Ige. Thank you for finding time to come and honor this occasion, even in your busy schedule. And we were aware that you were teaching the students and you were able to cut it short and release them and be here in person. We're very grateful to you. Thank you, sir. And to our dear lecturer, resource person that has made this course very impactful and interesting. We heard all the students said, and then to the security officers, I know what they said. They were like, oh, we are doctors, at least for one day. Thank you very much, sir, for making this very impactful and very interesting, and for accepting to come down to Nigeria, even when your family members are not around. Thank you so much, sir. We thank our dear Professor Edozie. Thank you so much, sir, for gracing this occasion. When we call you again, please, sir, honor us again. And to our dear director, Professor Kayode Osumbade. Thank you so much, sir. And thank you for the teaching, the corrections, and for allowing me to learn under you. Thank you, sir. And to our staff in Center for Health Profession and Biomedical Education, Prof has said it all. That we planned wouldn't have been executed. We were in the background, but you're the foot soldiers. Thank you so much, Dr. Joe and everyone. Thank you so much. Then to my dear colleagues, Dr. Adejimo, Dr. Kinkumi, it has been very nice working with you people, and thank you for all you have been doing, and for even being present during the classes, during the course, and finding time to even come and grace this closing program. Thank you so much. Dr. Adejimo, we also thank you, and we know that you are representing not just yourself, you're here in multiple capacities. To all you are representing, please extend our greetings. We are grateful. Thank you so much. To our PRO, the technical team, all of you, thank you so, so much. It wouldn't have happened if you were not around. To our Chief Security Officer and the security officers, thank you so, so much. I was so grateful during your course, how you cooperated and participated actively. We are grateful indeed. Thank you so much. My dear students, great Unimed students, great Unimed students, greatest of the greatest of the greatest. Thank you so much. We heard all your comments. We heard everything you said, and we are grateful to you all. And to everybody, all in the background, that has made this program very interesting and successful. We are very grateful to you. And Mr. Vice Chancellor, sir, with your permission, we need to thank just one person that has allowed our existence up to this moment. It is just by his grace that we are all here. If you permit me, sir, can we just stand for 1 second and appreciate God in heaven who has made this to come to pass? Please, we thank God Almighty who has brought us together, made this program very successful and impactful. Without him, it wouldn't have happened. By his grace, we are all here. If not for him, we would have been consumed. But here we are, enjoying the breath of life, and we're able to celebrate this, do the program, and everything worked well just because of him. To him be all the glory. Thank you, everyone. Thank you, sirs. Thank you all. Thank you, thank you, thank you, thank you.
Thank you so much. Thank you, sir. Thank you. Thank you, sir. I appreciate your help.
You're welcome, sir. Thank you, sir.
And we'll rush off to
I think the only person that has not been appreciated is the Deputy Director of the center. Thank you, ma'am. So next is a group photograph with a group photograph. The students can participate in the photograph. Yes, please hold on. You will be in this photograph too. I think we skip that. Let's skip